So, Johnny Owens.
Johnny O.
Johnny O is on the show today.
Then start watching. I don't know what the hell you're listening
Yeah, I know.
for. Fast forward already.
There's nothing much else to say. We had a blast talking to Johnny Owens. We talked to him at the Alamo Draft House here in Austin, Texas. He was in town doing a course here, and man, we learned so much about him, about blood flow restriction, about how to go about treating people that actually makes sense. That's actually based on physiology. You got mTOR? You got that mTOR though?
You got that mTOR, man?
No.
If you ain't got it, hit or mTOR or bust. It's very simple. If you're a therapist and you're not blood flow restriction certified, you're behind. And if you're a patient that's not getting blood flow restriction post-surgery, you're in the wrong spot.
It's bold.
It's
So
like,
what's behind that though is you got protein synthesis or not, right?
true story. Is a straight leg raise, is that active range of motion, or is that anything? Is that
Not to the physiologists at CFI. They would call bullshit on that.
It would be.
Say, what you doing? You doing a range of motion there, boy?
So Dr. Owens, Johnny Owens is one of those names that you go check him out on ESPN. You go check him out. He's on Sports Illustrated. He's in Forbes magazine, and he got to talk to us about his journey of starting Owens Recovery and what it's like to make that commitment to yourself.
Yeah.
Morals.
All the sacrifices he made to kind of jump off from CFI to start that endeavor with Owens Recovery.
Some great lessons in there about what you need to have in your mind when you start your own business or anytime you go start a new adventure. Make a commitment to yourself and your family.
And we were super impressed by how he was focused on doing the right thing and doing it the right way, not taking that early venture capital money that he would have, lost some of his business, lost the direction, take a route that he didn't want to take with his company and his brand. I thought that was really remarkable to hear him say, "No, we're gonna pass on that money. We're gonna eat some shit sandwiches for a little bit longer because I want to do this my way, the right way." Enjoy the show.
Enjoy the show. You good?
Good.
All right.
You can come in a little bit.
Okay. You did huddle up.
cozy.
Get
Huddle
cozy.
up, right?
We got coffee.
There's a room
So,
right here. Huh? There's a room right here.
You gotta sit on.
so tell me about
We're in
being up
Austin,
behind
right?
We are.
Johnny.
I don't know if your dad would be cool with that, but
Yeah, I know he wouldn't.
that's how we opened the interview. Tyler's sitting on Dr. Owens' lap, and we're just chatting. Just chat.
No problem there.
No
All right,
problem.
So we got Johnny Owens here, and he just came back from. He got a text message. One of the better text messages I've got in my life.
Tyler, we were eating at Subway, and we were just eating. We're planning out what we're gonna talk to you about, and Tyler just is laughing, and he shows me this text, and I'd almost throw up on my turkey.
Says, excuse me, going to be 15 minutes late. J.J. Watt and the Washington Wizards holding me up. Tell us a little bit about that there, Johnny.
Not sure if I can go too deep into detail on it, but
Gotcha.
yeah, basically we just had some shipping issues that we're trying to take care of a
Cool.
little bit. Yeah, so yeah, they're interesting problems. These are definitely first world problems that I'm dealing with.
Yeah, I don't think I've never received a text, I think, of that magnitude to be like,
I just want to make you guys feel important that
Right.
it wasn't, yeah.
Part of it. Oh yeah, no problem.
Super
JJ
important.
again,
Yeah.
right? He's always doing that.
You're about to text him something like, typical.
Yeah.
We get this all the time.
Yeah.
Very standard. We got to figure out, are you a Spurs fan?
I got to be real careful
Like,
with allegiances here. So I am. I love the Spurs. And
Okay.
so a little bit of background with the Spurs. So I'm not from San Antonio, right? But I just think everyone has to respect the Spurs and the Spurs way, right? And especially Duncan and the Admiral and everything they've done. At San Antonio, at the base where I am, where I was a lot more, I still kind of have some relationship there. The Center for the Intrepid, kind of the shining star rehab facility. The Spurs play a big role in that. So we have a Spurs wheelchair basketball team. The Spurs donated and built a basketball court. It has their branding all over it. They come all the time, and they're great. So I am a big Spurs fan. I spent a lot of time. My parents are divorced. My mom was in Houston. I was in Houston a lot, especially during the Dream years. And so I kind of am a closet
Rockets
fan as well, just because I loved Olajuwon, and that team during that time I thought was pretty amazing. But now I'm a fan of all teams now.
Yes. Yes.
Yeah.
But no, I love the Spurs, and I'm a big fan.
Very cool.
Yeah.
Very cool. I remember listening on the podcast with Therapy Insiders. They opened up talking about how they just got done with the thing about business and everything. And you made a quick little comment. It probably just was in the context of how, I'm not the guy who talked about business, but I do see you have, the Johnny Owens rehab going on. Are you kind of doing your own thing these days? And if so, what kind of drove you to want to open your own clinic? And could you speak a little bit about that?
Yeah, well, it's real multifactorial, I guess, and so I love being a clinician. I think there's a lot of burnout, but I still love being a clinician and love what I was doing. But I'm almost I think I'm got some sort of Asperger's that isn't diagnosed, because I get into things and I just cannot let them go. And so every point, I guess, since I've been a therapist, there's been just something that I've really just latched onto, and I just can't get enough of it. And so before this, it was this exoskeleton. Before the exoskeleton, it was this regenerative medicine stuff that we were doing. Before that, it was just anything and all thing, sports medicine related. And the wars were winding down where I was, and it was becoming a different environment than what I was used to. And I never felt like I could leave while we were having the guys and girls come back. And I was very committed to them and always looking for the best solution. Thank God the wars ended, and I started seeing, this is a different place. Is this still what I want to do? And at the same time, I was really starting to see the value of this blood flow restriction rehab, as we call it. And what I wanted to do too is, one of my good buddies, he's our past trauma surgeon, Joe Shu, he said, there's so many things that have happened from wars and DOD in the medical side of the house that no one ever knew about. And he laid out all these different examples of these antibiotic treatments that never went anywhere from Vietnam. And basically it's just because they weren't able to populate out from that DOD and these kind of austere environments where just you can do whatever you have to do.
Yeah.
And so I thought, this is one of those things I think really deserves getting out there, because I really thought it was ready to start moving out into the clinical world, because we were just seeing such success from it. And so then I started branching out and consulting primarily with the pro teams. The DOD doesn't really love for you on the side to just have this little side gig where you're going around working. And our head JAG attorney, who's a buddy of mine, he just said, why don't you just start doing, you look like you love this, why don't you just start doing this as a full-time gig? And I was like, I don't think I'm ready. I'm not a business guy. I need a paycheck, and I love being here, and I'm a GS employee. And, then I started thinking a little bit more and more consulting emails were coming in. Hey, would you please come here? Would you please come here? And so then I basically just took the leap. And then I didn't just say, I'm done, I quit, and I'm just going to do this. Prepared a lot, met with a lot of business savvy folks in the medical industry and outside the medical industry. And learned that I have a lot more leverage, and I think a lot of us have a lot more leverage, especially when you've been doing something for a long time, more than you think you do, where you can get more from people than you think you would, as far as even billing fees or medical consulting fees, whatever. So then I broke off and started doing consulting, and then we rolled it into a full-on corporation with founders along with me. I'm the primary on it. And it's been, in a year, it's been extremely successful.
Very cool.
When did you start that endeavor?
So last year in May was when I officially cut ties.
Wow.
And no, my bad. Was it last year? It's 2015 is
Gotcha.
when I broke off. Yeah. So that's when I left. And so it's been over about a year and a half now.
Awesome.
That we've been doing it.
Yeah.
Great.
Yeah.
And I do want to kind of get to BFR in just a second, and for those of the people who might not know all about it, but staying on the course of business, what are, if any, of some points that were just big eye-openers when you started doing your own thing by yourself that you said, I never knew I had to pay so much in,
lawyer fees, accounting fees, and I'm very much into doing things right, and my bigger vision for this isn't, I'm not a big money guy. I'm really not. I still drive my old 2004 Nissan out there, and we're very comfortable. And so my goal is to do this right, and if it's done right, you have to make a lot of sacrifices. And so we wanted a medical device, and we wanted to work with the FDA, and we wanted to try and get a code for this. We want to work with the APTA. We want to work with these orthopedic, large groups and hospitals. And by doing that, you have to really establish yourself in that world. And it costs a lot, and it takes a lot to be able to do that. It's just not like, hey, I'm a blogger, and here's this thing. I mean, we're a medical device corporation, a medical device that's listed with the FDA. And so that took a lot and cost a whole lot. And what I learned quickly too is you think there's like a bat signal. You're going to start a business and you're going to put it out, and like, oh my God, the phone's going to be ringing off the hook, and you're getting all these emails. And I had drivers, I had ESPN and Forbes magazine, and I had media, and my Rolodex is huge of people that I could contact. But still, I think this one saying was from the Phil Knight Nike book. He said, well, one thing is this Japanese mentor told him is, the bamboo, you see it this year, you're going to come back a year later and it's about a foot taller. And that's kind of a way I think I had to step back and look at this as like, this is going to be a slow moving machine, and I want to just take it slow and do it right along the way. And I don't care if it just blows up or not, but take your time to do it right.
And that was easy for you to do because you were so passionate about
100%. And you have to, they're not going to understand it, but you have to make them kind of understand the sacrifices with your family. And that was a big part. Because I told my wife, hey, I'm giving up this nice gig at the Department of Defense where you can't lose your job no matter what, pretty much. And she always heard me talking about how much I love my job, and I was like, hey, I'm going to do this. And by the way, it's, I think last year for a point, I was traveling almost every week.
Yeah.
I probably traveled like 40 something weeks last year. And you have to just lay that all out with your family, and they're oftentimes not going to understand exactly the motivations behind it, but they have to understand and be on board, or it's going to fall apart if you have a family or anyone you're discussing it with.
That seems like a huge part of success.
Mm-hmm.
Just because, like you said, I can't imagine. You have a dream job, and then like from the outsider, it's like, okay, you want to leave your dream job to do what exactly?
Yeah. And how am I going to get paid?
Yeah.
And I mean, it's all crazy. She's awesome, my wife. I mean, we sold our house because I didn't want anything over my head. Like if this falls apart, the house is going to foreclose and all this sort of stuff. And so she asked me how serious I was. I said, I'm very serious. I don't want anything holding me back. I'm very passionate about this. We sold our house. We moved our 4-person family into a little 2-bedroom apartment so that I would have enough cash to hold on to, and we wouldn't have any worries. It was awesome. It's one of the best years of our life. We were just, it was a little tight, but we were all close together, and they knew I'd be traveling a lot, so can't be out there watering the plants and stuff like that.
You did it mainly to bring the family closer. That was the reason.
Yeah, after a year, my wife's like, "Are we ready to move out of this?" So, but I think you have to be willing to sacrifice and rice and beans it, even if you don't have to. But if you're that committed, you better be willing to sacrifice if you want to do something that means something. I think.
Seems like you can't avoid the sacrifice.
No.
Seems like a common theme.
No.
That anybody who's successful is like, yeah, we had to eat rice and beans.
You do.
We had to go through this tough spot for a little bit.
Yeah.
Yeah, and I didn't want people to direct me of how this is going to be done, or you need to, be making this much or whatever. So there was no going after venture capital funding rounds or anything like that. It's just bootstrap, and I want to make my own decisions. And if I only get this much happens over this month, that's what it is. But I'm not going to change my values of this, and so that was another big part, because once it starts, you get these names and some media, and all of a sudden you got these VC people coming at you and people wanting to give you money, but then you see what they would expect, and I'm never going to give up my morals or what I wanted to envision it to be. So.
Wow, that's another huge part.
Yeah, like the morals and holding true to who you are and not succumbing to...
When people are dangling money in front of you, and you're also like, I want this is my baby, I want it to happen.
Yeah.
Right.
And they're talking scale, and this is the only way, and you can't do it as yourself, and then you're just like, well, give me a year, and I'm gonna do this myself, and I think it's that important, and it doesn't really matter. And they're saying you're missing this opportunity, and all these other, and that's happening. But again, I can always, lay in bed every night and be like, I didn't compromise and try and do anything different than what I said initially. I kind of wrote down this mission statement for myself of exactly what I envisioned this to be. Now, a business plan, or my wife's like, well, where do you want this to go, or how much is another? What? I don't have any idea, but I knew these like bullet points of like, I like to follow this set of rules, and you have to remind yourself that every now and then when you get wrapped up in it.
Yeah, that's awesome.
Yeah. So you want to go into talking a little bit about BFR, and I think I'd like to kind of go through a story. So I tore my ACL last year. I can't remember too much, but I'm going to have ACL surgery this year, and just kind of talking about it. What would it look like if I were to do BFR coming out of surgery? How long would I be on it? And when do you start it, and things like that? Could you just kind of maybe talk about like the story if someone was going through ACL?
Yeah. So in an ideal world, so say you're coming to the DoD or one of our clinics or healthcare centers who do it a whole lot, and they're very comfortable with it. Everyone's on board, ortho's on board, management's on board, blah blah blah. Ideally, we would like to get you in pre-operatively when because once you tear it, and there might be issues that could hold you back. You have a bone bruise or cartilage lesion or whatever, where pushing a heavy load might not be the best thing in the world. Get you in pre-operatively if you have some signs of weakness, and do it maybe 2 to 4 weeks before, just to kind of get the quad going. We know it increases muscle activation. We know we get strength and hypertrophy from it. Post-operatively, here's kind of where things start to change, and where we think BFR really has a big play. If we're just talking for this conversation, strength and hypertrophy, post-operatively, you're down and out, right? So you can't use that limb. The problem when you can't use the limb is that the muscle starts to basically atrophy away. We've all seen that. And so one thing that was beautiful that I was taught from these great folks I was with in our research groups at the DoD was to always work backwards. It's these kind of after action reports they do. So they go out on a mission, they come back, and then they kind of work backwards, like what went wrong with this mission? Let's figure it out. There's no poo-poo lips or butt hurt. It's just like, you messed up here, you just here. What's the problem? So we'd come to these meetings, they're like, well, what's the problem? Why do you think people are losing muscle mass? And they're like, I don't know, it must just be a non-use thing. Well, that doesn't explain how you're going to figure out a solution. So you have to know where the problem really stems from. And these were great minds that I was working with. And some of the protein synthesis folks there were showing us research that was saying, look, people atrophy because protein synthesis goes down. Okay? And so if you stop using the limb, on healthies, when they look at this in these studies and in academic centers, if they put them in a mobilization for a few weeks, protein synthesis drops in that limb close to almost 30% in some studies. Only in that limb, though. The rest of the body, it doesn't change. And so that's where atrophy starts to happen, and that's where muscle mass starts to go away. And you see it. Someone gets an Achilles repair, they take their boot off, and you're like, holy crap, you got a tibia for a calf, right? Yeah. Same thing happens. We see the quad just waste away. And so we're saying, okay, there's a protein synthesis issue. How do you turn protein synthesis on? Well, if you take a protein and get your bolus of leucine, protein synthesis will go up, but it only is going to go up to a net amount to deal with the breakdown that happens on an everyday basis. If you go lift heavy or go exercise with resistance, then you get this little spike in protein synthesis. And that's why lifting heavy over time, you have breakdown when you lift heavy, but you get more synthesis, so it goes up. So you can lift heavy. Well, you're not going to do that after your ACL. And we brought our physiology guys, and they said, well, let's kind of look at your problem. And they're watching what we're doing in rehab, and they're like, you guys are kidding us, right? Why is that guy doing that with his leg, lifting it up and down after the surgery? And we're saying, well, we're trying to do his exercises, turn his quad on. And they're like, we told you it's a protein synthesis issue. There's no ACSM guideline that says, go lift heavy and turn this on, or go do these little straight leg raises in a mat, you turn it on. So he's like, you guys are just doing like range of motion, it looks like, right? We're like, well, no, we're trying.
Activation.
Yeah, and I hate wasting time. I'm a real black and white, and I don't like wasting anyone's time. And the patient comes in like, what do I do there? You're like, oh, the same thing. Here's your protocol. And they're just like, seriously? That same stuff? And we are. If they're rolling your eyes, we're rolling our eyes. There's a problem with it.
Yeah.
So then we started going deep into the literature and seeing, is there anything else out there that looks like it's turning on MPS? And BFR was one of those. And so it looks very positive from multiple studies. If you do BFR, protein synthesis gets elevated rather rapidly and pretty quickly, close to lifting heavy. without the breakdown of muscle, so you get kind of an extra boost of it. So we would want to get you in as quick as possible because you're losing muscle mass. It's called anabolic resistance, to get BFR on you to turn protein synthesis on. And so we when you go to my courses and we talk about it, we're trying to teach you as a therapist to not think about these as exercise anymore. We're trying to get you down to this physiological cellular level where you're like, look, patient, I'm trying to get your muscle protein synthesis turned on because you're losing almost 30% while you're not using this limb. You're coming to see me because I've got this little magic switch and I'm going to turn MPS on. And so you do this to try and mitigate atrophy and start to get through the mostly quad for your ACL back to where it needs to be. Then you kind of transition into lifting some loads with it with BFR, and when your strength is close to the other limb, then we transition and we go to lifting heavy, because lifting heavy is great, and I think it wins if you can lift heavy, but you can't in your early phases. The surgeon would come and kill me if I started you on early loads, right?
Yeah.
The big problem with ACLs, and we see George Davies spoke with me at a conference, American Symposium conference earlier this year, laying out all these studies showing that ACL patients are weak in the quad on down the line. Weak. You're still weak. Our problem is we kind of do this glorified Jane Fonda's in the clinic thinking we do something. Then we kind of do a little bit extra lifting, maybe some load.
Yeah.
And then it's like, now go. Now be functional, man. Why aren't you doing your functional stuff? And we become these functional freaks, and it's like, I bet that guy's squat would look beautiful if his quad wasn't 30% weaker, right? And so people poo-poo things like, well, why are you doing that long arc quad or something like that? It's because I need to get his quad back. And when that's symmetrical, then everything else is going to clean up. And so I think that's where we missed a lot of the boat. And I challenge people too, explain to your patient that anabolic resistance thing. Preoperatively tell them, look, you're going to have the surgery, doc's not going to let you use your limb, you're going to lose 25-30% protein synthesis, which means you're going to lose about 10% of the size of your quad over about a 2-week period. You're going to lose potentially close to 30% strength. And when they come in, do your exercises with them. And then they can say, did you fix that problem you told me about, the muscle protein synthesis? No, sorry, I just had you do some leg raises. And you tightened that thigh muscle up, but my bad, no, but pay your copay and I'm going to bill you, right? And so that's a real problem that I have with what we do. And that's insurance companies are smart. They're looking at it now and being like, so spinning on that bike for 15 minutes, we're seeing that doesn't do a dang thing, right?
Yeah. Wow.
And so we have to come up with solutions. Now, if we could say, well, look, I got a protein synthesis switch I can turn on, or I can push this person's endogenous growth hormone release, and maybe that helps with collagen synthesis, or I can increase stem cell load by doing something like this, which, guys are getting $2,000 a pop to do these stem cell injections out there. We need to become much more savvy at that kind of science if we're gonna be able to keep getting reimbursed.
I feel like the gauntlet's been thrown down, right?
Well, thanks for having us. On that note, I'm gonna go home and do some reading. That got me really excited.
Yeah. And he said it. He said in another podcast, like, people get jazzed up when they start hearing about this because there's no way to deny it, right? You start, and for those who just Google it real quick. This is a little bit of a follow up, and then I'm sorry, Jared, cutting you off a little bit, but
there's so many thoughts going through my head. Like, ever since I was a technician, through college years, undergrad years, and you're a technician and you're telling people to do those long arc quads and quad sets, and you got your checklist and just watching them do it, and you're like, I don't think it's really doing anything.
Yeah,
I know.
You don't even have to be a specialist to really. You kind of look, and something about you like.
And like the person, we've got an elderly person or whoever just watching Judge Judy doing this.
Yeah,
it's
my
like,
mother-in-law went through rehab and she came back and she told me, that's what you do. She was explaining. It was almost embarrassing for me, to try and explain to her. Well, no, and she's like, and she just quit going. She's like, I'm going there and I'm just counting. They got a technician following me around, and it's just, that is embarrassing to me. And now we have all these gurus who are like and I'm a functional guy too, but I mean, we're getting so wrapped up in, well, are they able to do their get-ups, and then can they do this and do that, and how about their squat? And it's like, dude, if we need to worry about this early stuff and really get to the root of what the real problem is, you know? And so I'm going to use these magical hands and magical tools and try and deal with scar, and then it's not, well, then figure out the scar pathway. And then we're looking at, well, there's a pathway we need to figure out how to block. Can we do that with what we do? Is there pharmacology that can be combined with what we do? And so, we just have to, I think our profession's in dire straits, and we need to take a step back because we have some powerful things. We have some powerful allies that want to help us, but we have to just get past this. I don't know what phase we're in now, but we're gonna just jump on and do whatever.
Viral treatments.
Viral treatments. That's your term. It's perfect.
It seems like you like to do a lot of like reverse engineering.
Mm-hmm.
Yeah.
I like that.
Yes.
It seems like that might be what the profession needs to focus more and more. It's hard to deny that.
Yeah.
When you first started doing the blood flow restriction, were you kind of the only one doing it in your clinic, or were they all doing it? Were people looking at you like you were crazy? Because from an outsider looking in, you're thinking, what the hell is he doing?
Yeah. So my last title that I had was Chief of Human Performance Optimization, and it was if there was a problem, then I could kind of use all of our DoD solutions, not only there at Brooke Army, but also throughout the country, to kind of come up with a solution. And so I'd been doing regenerative medicine work across the street at what's called the Institute of Surgical Research, which is some of our great science minds. And it's also luckily where they do tourniquet research for the military. And so we were working on this problem because we were having a problem getting our limb salvage, our blast guys, strong enough to avoid delayed amputations. And that's with those guys and the tourniquet guys, we started looking, and I kind of first stumbled on some of these older blood flow restriction papers and bringing it in with there, and then in their lab, we were goofing off with stuff. So they have animal labs. They have little penis tourniquets they use on the animals and stuff.
Is that in the course? Can we?
Yeah, you don't want that one, man. Even seeing that, I still squirm when I see that thing. And so we were doing it, mostly me, and then I would take it over to the Center for the Intrepid, and we were doing it on some of our technicians and assistants and other therapists. And we got our first research tourniquets from the tourniquet guys over there, and we chose 10 special forces guys because they're willing to do whatever. And people are like, man, you chose a really tough group to do it on. We chose on limb salvage, which is bad trauma, but those guys were kind of our bad joke was they were going to cut their leg off anyway, so if it falls off, whatever. And so they're like, fine, put it on, I'll do it. And I'm so messed up, I'm willing to do anything. And it took off like a rocket with them. And we retrospectively put a paper out in Journal of Special Forces, and that kind of got the whole ball rolling and started moving into the general population.
And what year was that?
Oh man, so that was probably 13. Yeah.
Was that took about 4 years. I feel like right now blood flow restriction is one of those things that when someone mentions it, they kind of got an idea about it. So it took about 4 years for it to be from the ground level.
Yeah, I mean, people would look at you cross-eyed when
I
you first talk about it.
I bet.
I used to see my surgeons when I went and talk to them. They're like, "You're on crack, Johnny, really?" And so they're like, "Did you vet this with the command?" And so
is that the same room with the people with the penis tourniquets on?
Yeah, right. You've been hanging out with the ISR again with the penis tourniquet guys.
It's a weird room, John.
Yeah.
I don't know about that room.
Yeah, it was. I mean, you would tell people, and they just look at you. And now, I mean, people are like, now everyone's like, "Oh, I've been knowing about this forever." This sort of thing. But it's good. It's definitely becoming more mainstream.